Welcome to the Vet and Crit Academy, where we discuss veterinary emergency and critical care and science-based tools for vet professionals. In this video, I'll show you why calculating osmolarity is crucial when administering concentrated potassium-containing solutions and how to use a free web-based potassium supplementation calculator to simplify this process. Let's walk through a case. Imagine that a colleague of yours is managing a 24.9 kilogram dog with a small intestinal obstruction caused by a foreign body. The plasma potassium level is 2.9 millimoles per liter, and the attending veterinarian wants to improve this value before surgery to reduce the risk of tachyarrhythmias and ECG abnormalities during anesthesia. The chosen supplementation rate is 0.3 milliequivalents per kilogram per hour of KCl. To achieve this, the plan is to mix 22.4 mils of KCl with a concentration of 2 MEq per mil with 7.6 mils of LRS, making a final volume of 30 mils to be administered at 5 mil per hour by a peripheral catheter. But here's the question: is this approach safe? Let's find it out using the VetMCREAT potassium supplementation calculator. You go to vetmcreat.com and click on the said calculator. You enter the patient's weight, 24.9 kilograms, serum potassium level, 2.9 millimoles per liter, and the desired potassium supplementation rate, 0.3 MEq per kg per hour. You input the fluid type, LRS, fluid rate, 5 ml per hour, and total volume of the syringe, which is 30 mils. You select the KCl concentration, 2 MEq per mil, and click Calculate, and here's the results. The calculator confirms the math. 22.4 mils of KCl mixed with 7.6 mils of LRS provides the planned supplementation rate. However, the solution's final osmolarity is 3,057 millismoles per liter, which is far too high for safe peripheral administration. Most guidelines recommend less than 650 millismoles per liter for peripheral lines and less than 1,250 millismoles per liter for central line. So how can we fix this? Here are the 3 practical solutions. Option number 1, you can adjust the dilution ratio. For example, increase the ratio of KCl to LRS, changing it from the current 3 parts KCl to 1 part LRS to something like 1 part KCl to 9 parts LRS. Mixing 1 part KCl with 9 parts LRS reduces the osmolarity significantly and brings it down to about 645 millimoles per liter, making it safe for peripheral administration. Alternatively, switching from LRS to sterile water can further reduce the osmolality, especially if maintaining a lower fluid rate is critical. Using sterile water, a ratio of 1 part KCl to 6 parts sterile water will reduce the osmolarity to approximately 571 millismoles per liter. Option number 2. You piggyback the solution onto another fluid line. This technique involves connecting the concentrated KCl solution to a fluid line running at a higher rate. For the original KCl solution running at 5 ml per hour with an osmolarity of 3,057 millismoles per liter, the primary fluid line must run at least at 40-45 ml per hour to bring the combined osmolarity below 650 millismoles per liter. At the same time, the following considerations must be kept in mind. First, adequate mixing. The 2 solutions must mix properly before reaching the catheter to prevent vein irritation. For instance, if the KCl line is connected to the main line right at the catheter site, mixing may be incomplete. Second, compatibility. The primary line should have a lower osmolarity and be compatible with the KCl solution. And third, fluid rate. Any reduction in the primary fluid rate could result in exposure to a hyperosmolar solution. In summary, while the piggybacking technique can quickly reduce the osmolarity of the KCl solution, it carries several risks and requires careful consideration of multiple factors to ensure safe implementation. And option number 3, you can use a central line. Placing a central line, for example, jugular vein or peripherally inserted central line or PICC line, allows safe administration of higher osmolarity solution. Central lines can typically handle up to 1250 millismoles per liter, and in some cases up to 2000 millismoles per liter. However, even with central lines, exceeding recommended osmolarity increases the risk of complications. By the way, if you'd like to learn more about intravenous potassium supplementation, check out our free RACE-approved course linked in the description below. So, what are the key takeaways? First, always calculate the osmolarity of the electrolyte solutions, especially when creating concentrated mixtures. Second, aim to keep osmolarity within safe limits, less than 650 millismoles per liter for peripheral lines and less than 1250 millismoles per liter for central line. Third, use tools like the VetMCR calculator to simplify complex math and ensure a safe potassium supplementation plan for your patient. Thank you for watching, and don't forget to watch more videos like this on the VetMCR channel.